Welcome. I'm really delighted to say hello to each and every one of you for joining us today for our webinar on unlocking digital health excellence through the ORCA India Data Protection Mark, with a specific view on digital health compliance and the Indian Digital Personal Data Protection Act. So to introduce myself, my name is Fiona Costello. I'm Senior Vice President of National Accreditations at ORCA. I have been with ORCA for a couple of years, leading on the development of assessment frameworks and working with national bodies across the world to help govern the use and deployment of digital health in healthcare settings in a way that maximises benefits for service users, but also healthcare professionals. So I am very lucky today. I'm going to be moderating today's session. But before we begin, I wanted to draw your attention to a critical matter that underscores the urgency of today's discussion. So yesterday, I spotted an article that highlighted that the Federal Trade Commission in the US has proposed a $7 million fine against Cerebral, a mental telehealth firm. This punitive action has come in response to Cerebral's alleged mishandling of patient-sensitive data and their practices regarding data sharing and privacy policies. So the FTC uncovered alarming revelations. So not only did Cerebral demonstrate carelessness in safeguarding patient data, but they also actively shared it with third parties for advertising purposes. This breach of trust affected nearly 3.2 million consumers, exposing their personal information, including home addresses, email addresses, phone numbers, and medical histories, to platforms like LinkedIn, TikTok, and Snapchat. Last year in the UK, an investigation revealed that several NHS trusts had been sharing sensitive patient data with Facebook without obtaining consent. The data shared included detailed information about patients' medical conditions, treatments, and appointments. The breach was facilitated by the Meta Pixel tool, which collected and transmitted the data to Facebook, potentially affecting millions of patients. The information shared could be used by Facebook's parent company, Meta, for targeted advertising, among other business purposes. So following that discovery, most of the implicated NHS trusts removed the tracking tool from their websites and issued apologies. But the Information Commissioner's Office has initiated an investigation into the matter. Both events, of which there are many, underscore the critical importance of data privacy and the need for stringent measures to protect personal information in the digital age, even with legislation such as HIPAA, GDPR, and the DPDP. I know that, Liz, you're going to be delving into some of the critical reasons as to why we're here. But before we start, I wanted to be able to give my own thoughts about why this matters. Every time a digital health product is highlighted for not observing best practice data privacy standards, it erodes the trust of end users. It erodes the trust not just in the product itself, but those who recommend it or advise them to use that product. This means that they're unlikely to use it, and they're unlikely to therefore trust the healthcare services that may have commissioned it. And this undermines the business case and the clinical case for implementing the technology in the first place, which limits the transformational impact that the product might otherwise have had. This really matters. Healthcare services around the world are tackling significant systemic challenges, including demand management, capacity planning, resource optimization, and prevention-focused activities. So we need digital health. It's vital that we take appropriate measures to earn the trust and confidence of healthcare professionals, patients, and citizens. And time and again, data privacy is integral to earning that trust. It comes up in report after report after report that says that data privacy is their number one concern, whilst clinicians and healthcare professionals might concern themselves with the evidence base, the ROI, patients and citizens are worried about what you're doing with their data. So in the next 90 minutes or so, we'll be delving deep into the evolving landscape of digital health, focusing particularly on the Indian healthcare ecosystem, which is very exciting, and its alignment with global standards of data protection. We have an amazing lineup of speakers, each bringing their unique expertise and insights to the table. We'll hear from industry leaders on topics ranging from the current state of digital health in India to the implications of the Indian Digital Personal Data Protection Act. Additionally, we'll explore the need for the ORCA India Data Protection Mark framework and how it can be effectively implemented by US digital health suppliers or by healthcare systems looking to use those technologies. We really want active participation from all of you, whether you have burning questions, insightful observations, or simply want to engage in the discussion. We welcome your input. You can use the chat function and the Q&A function to ask questions or share your thoughts, and we'll do our best to address them during the Q&A session. But in the meantime, if we can all please be on mute and allow the speakers to deliver their sessions, that would be very much appreciated. And by the end of the webinar, our goal is to equip you with valuable knowledge and actionable insights that you can apply to your work in digital health. So we'll be recording today's session. As I say, if I can kindly ask you to ensure you're on mute to avoid any disruption to our speakers. And as we wrap up, I'll provide some key takeaways and insights to guide next steps, including how you can initiate conversations about how to participate in the OIDPM assessment. So once again, thank you for joining us today. I hope you're as excited as I am for the enlightening discussions ahead. So let's embark together, committed to unlocking digital health excellence in India. So without further ado, let's get started. In an increasingly globalized market, it's essential to understand how global experiences can inform and guide India's approach. So today, I am delighted to introduce you to Liz Ashwell-Payne, CEO and founder of Orca and a trained speech and language therapist by background. Liz is also my boss. But she is globally renowned for driving best practice in digital health assessment and activation, and it is well regarded as a true visionary in digital health, having founded Orca, the organisation of the review and care and health apps, nearly 10 years ago. Over the last decade, the organisation has grown exponentially, now providing digital health assessment and distribution services in 11 countries and in the UK to organisations in 70% of NHS regions. So, Liz, I am going to stop talking and give the floor over to you. Thank you.
Thank you so much, and what an incredible opening session. Thank you, Fee. So I'm absolutely delighted to be joining today's session. As Fee said, my name is Liz Ashwell-Payne, and I'm going to share my slides with you, which I would really appreciate somebody saying whether they can see this before I start.
Yep, we can,
Liz.
Liz.
Excellent. So just a tiny little bit of background. So as Fee mentioned, Orca was founded quite a few years ago now. And one of the things that I wanted to mention was our mission. So Orca's mission is to improve lives through digital health. And one of the big challenges that we see in trying to achieve that is the trust barrier. People don't know what to trust. And of course, they see press release and they see news about challenging situations with data and other parts of assurance. And that is really the biggest barrier to adoption. And so what Orca have done is we've created an infrastructure that allows us to quality assure products to regulatory requirements, but really importantly as well to mention, we then distribute them. And I will come on to that very, very likely. But of course, today's session and what I'm going to talk to you about is very much on that assurance side. And one of the things that we quite often talk about is why assurance is important. And I've obviously talked about briefly there the trust barrier, but there's some real pragmatic reasons why we should all get interested in compliance and why it's important and why it can help you. So for the first reason is, of course, there are legal obligations. So compliance with regulatory requirements is not optional. It is a legal obligation. And as Steve talked about there, with two examples, unfortunately, some products that don't meet those legal obligations end up with quite severe legal consequences, including fines. So just on a really basic level, that's a good reason to really think about this. The other reason, which I know every single person on this webinar will be keen to embrace, is patient safety. Of course, making sure that you're compliant with requirements ensures that patients using products achieve safety. And of course, everybody in this sector, everybody who's really trying to support patient access and improve patient health outcomes is really keen to make sure that products are safe. Of course, the thing that we're going to be talking about today is around data security and privacy. And of course, there are digital health technologies collect, store, and transmit sensitive patient data, and compliance with data security and privacy requirements really helps to manage your reputation as a supplier or your reputation as somebody who's distributing products. The other thing that's really important is market access. So I'm going to come on to a slide in a second, which will show you that there are over 360,000 digital health products out there. And of course, being able to prove that you're compliant and trustworthy helps you to be found in a very, very busy market area. And of course, as clinical teams and as healthcare system leaders, they want to know what can they trust and which products within a market should they be accessing. I've already touched on reputation and trust, but building a strong reputation and being able to be seen as trustworthy is absolutely critical. And so that's another good reason to think about compliance and, of course, managing risk. There are always risks in anything that we do, from driving a car to going in a plane, but that so is true with digital health technologies. And by looking at compliance requirements, we can manage and mitigate risks, which could include patient safety breaches or legal requirements. So that's really why we're here. And across the globe, countries are keen to engage in safe, quality technologies. So I just want to start by saying what the digital opportunity is, because you're all in the right place. Digital health has a huge opportunity on a global scale, and that's because we've all bought the smartphone device. So there are currently more than 6.6 billion smartphones on the planet, and every single day, 5 million people download a digital health app. And you can see that India is the third highest user of health apps. So people in India downloading products significantly every single day. And what we also know is that clinicians think that these technologies can help their patients, and age for young people is really starting to drive further uptake. So we've got a massive opportunity. However, even though we've got this huge opportunity, we know that there are some barriers, and I'll come on to that in a second. But of course, the opportunity is even greater than just consumers downloading these products. We know that digital health can really support the demand and capacity challenge we have on a global basis within healthcare. What I mean by that is more and more people are trying to access healthcare services. We do not have the workforce and the capacity to be able to deal with that demand. And digital health can really help with that. Of course, it can support people to self-care and self-manage. It can help you to manage diseases and ensure appropriate use of resources. But of course, it can also support with capacity, driving automation, decision support, telehealth, virtual wards. But we do have some barriers. And I just wanted to share with you here some research that was done speaking to global leaders, asking them what are the biggest barriers to a successful digital health strategy. So you can see there that 46% of respondents said that there's just too many products. They are inundated with products. And of course, what they need to know is which product should we engage with. And you can see there the 18% of respondents said that they didn't know which products they could trust. And that isn't unfounded. So the biggest barrier to the adoption and use of digital health technologies is that only 20% of that 365,000 large technology marketplace meet quality standards. And so the concerns about trust are not unfounded. And that's really where work like the OIDPM really comes into its own, by checking products we can know which products we can trust. Of course, the OIDPM isn't the only digital health assessment framework. And what I want to do now is just share with you some other examples of digital health assessment frameworks. And I want to give you that universal global overview of where this sits. Now, you may have heard of some of these digital health assessment frameworks. So I'm currently sat in England, and the NHS, which is the top right-hand digital health assessment framework that I'm noting on the slide, is the DTAC. And this digital health assessment framework was created quite a while ago with the premise of wanting to create criteria by which, if a product passed, we could trust it in the NHS. But of course, you can see on there the German DIGA. You can also see the French PCAB. You can see the United States of America Digital Health Assessment Framework. You can see the Belgium Validation Pyramid. And all of these digital health assessment frameworks are basically trying to understand whether a product has met criteria and therefore can be trusted and used within their country. Now, what Orca do is we are obsessed with questions and criteria to build trust. We want to know which products can be trusted so that we can safely distribute and embed these technologies into clinical pathways and into prescription infrastructure. And so what we've done is we've horizon scanned all of this criteria on a global basis and created a holistic understanding of all the questions and where questions are and where there is the same question. So this next slide is a very busy slide, but what it's trying to do is show you the different countries. So you can see it starts with America and then it goes on to Europe and then the NHS. And those different verticals are showing you what questions you've got to meet to be able to be trusted within that country. And you can see that there's on the horizontal side, there are some big bold colours. So up to the top of the pink line, you see the global baseline review. And what that global baseline review is doing is it's aggregating all the questions that everybody on the planet wants to know the answer to. And what we do at Orca is when we assess a product is we take products through that global baseline review before entering into any specific verticals, so that as a supplier, you know that you've met the requirements, the basic underpinning foundational requirements, which account for somewhere between 60 to 70% of all global digital health assessment frameworks. And I want to really drill into that global baseline review because there are three things that we're checking there. One is data privacy, the second is professional assurance, and the third is usability and accessibility. And I'm very proud to say that Orca have already assessed 27,000 products at this global baseline review. And so we've got a huge volume of knowledge in understanding where suppliers' compliance sits and also in supporting suppliers to meet those compliance requirements. Now, of course, today we're doing a deep dive into data privacy. Now, previous global requirements have focused on GDPR, HIPAA, privacy policies, data use, data storage, and existing standards, for example, ISO 27001. And we're going to have a bit of a deep dive into this when we're talking about the OIDPM. So, just very briefly, I'm going to give you a little overview of the OIDPM, and then I'm going to hand over to colleagues who are going to explore it further. So the first thing that I wanted to talk to you about was why was it created? Just really understanding why it was created. So of course, I've already given you that global overview, but that global overview very much resonates with why the DPDP was created for India. So digital health products, as we've already talked about, can empower users to manage their own health. I personally live with type 1 diabetes, so I use technology and data on a day-to-day basis to manage my own condition. But of course, that data poses a risk because it's sensitive in nature. So that's the backdrop. And what it's doing, that backdrop and that risk, is making me potentially concerned about using a product to manage my health. Of course, there's a huge opportunity. Engaged patients can take control of their health. So if I feel that I can trust a product and make sure that that product isn't sharing my sensitive data, then I'm much more likely to use it and then benefit from it. I don't only benefit, but the health system also benefits because, of course, that will prevent crisis and help me to manage my long-term condition in a much more coordinated way. There are, however, risks. So sharing health data with digital health products has that risk that I already mentioned. And so the India's Digital Personal Data Protection Act, the DPDP, acknowledges those risks and it recommends evaluation of digital health products against this act, which is absolutely critical for ensuring data protection. And so what we've seen emerge as a consequence is the ORCA Indian Data Protection Mark, the OIDPM, which evaluates compliance with the Act's key points. And what we're really hoping is that this really benefits suppliers to guide improvements to make sure that you're compliant, but to also really support more patients to have access to great technologies so that the opportunity can be realised. So, what is it looking at? This is fairly high level, and I'm sure that the slides will be shared afterwards, so don't feel that you need to take notes. But when the OIDPM data protection mark includes these two key areas. The first is looking at data scene setters, and what that is doing is looking at what data is collected, if the data is shared, who it's shared with, and how is the sharing done. Now, the reason we undergo a scene setter process is because, of course, not every product will share data and it'll be different types of data. And the reason that's important is because then, of course, the questions that are asked of that product to achieve the data protection mark has to be proportionate to the product that's being assessed. So once we've done those scene setter questions, we're then looking at, is there a privacy policy? Is the policy easily accessible to users? We're looking at the consent model for data collection. We're looking at whether the data is stored securely. What are the data principals' rights? What are the data principals' duties? And also importantly, children's privacy rights. And this process is something that doesn't happen once, it happens repeatedly. So ORCA's system will enable an ongoing compliance check. And that's really important because as an end user or as a clinician or as a healthcare system, I don't want to know that something had a data protection mark. I want to know that it has it. And so we built these systems and processes to enable ongoing compliance and making sure that it fits in with the Indian Digital Personal Data Protection Act. So the process that we undertake is that once a supplier comes to us, and we'll give you information in a second about how to do that, we will need some access to the product. So sometimes products are on the open market, sometimes they're not. So of course, in order to check and review and evaluate the product, we'll need access. The assessment team will then conduct a review and importantly, provide feedback. So this isn't meant to be a challenging process. This is meant to be a process by which if we find any gaps, we will share with the supplier areas for improvement so that we can achieve an iterative quality improvement process. What then happens is that a certificate is generated and you're able to use that and your product will then be listed on compliance and innovation portals. So a compliance and innovation portal are portals that healthcare systems, doctors, nurses can access to check whether something has achieved compliance. And then, of course, there is the re-review. So that a re-review will happen as a minimum annually or with each product update. So the engine, the process that we undertake will trigger a reassessment when the product changes, so we achieve that ongoing compliance. And the benefits of the assessment and compliance I've already mentioned in brief, but of course I've highlighted it from a patient perspective because I'm absolutely confident that every person on this call is here to improve the lives of patients. And of course, for patients, knowing that a product has met these requirements will help them to make better choices, better informed choices, and feel safe and that they can trust these technologies. Of course, for suppliers, and I think there are a number of suppliers on this webinar, having this certificate means that you can show that you are compliant, means that you can be found amongst thousands of products and be able to differentiate yourself. And of course, for healthcare systems, they want to engage with these technologies. They know that they have a capacity and demand challenge, and they want to make sure that they can engage with safe, trusted tools. So the benefits of this assessment and compliance process and the certification is absolutely fundamental to really dealing with that opportunity and getting the benefit. So once you achieve compliance, you will receive the Orca Indian Data Protection Mark, and you will receive a certificate, but also the badge that you can then use to promote your compliance. So you will get a certificate, but you can also start to leverage social media to showcase your best practice. And you can see here 3 examples where products are promoting that they've passed the ORCA, the Global Data Digital Assessment Frameworks, and they're saying that they've been certified to build trust, which is really paramount here. Now, I did briefly talk earlier about the fact that Orca does 2 things. We assure and evaluate products, but really importantly, we then drive that information through distribution channels. So once a product has achieved compliance, which is in the grey circle, what we then do is we will continuously check that product and also monitor the market for updates and continuously check for that compliance to that regulatory requirement. We will then work with other partners to support activation and access to technologies. So I touched on things like a compliance portal, an innovation portal, but we also have things like digital health libraries and digital health formularies where we place products so that healthcare systems and doctors and nurses can search, filter, find safe tools that have met this requirement and then embed them into their healthcare services with patients. And of course, we're also trying to support supplier awareness. So one of the things that we have created is a supplier academy. A supplier academy is for suppliers who want to learn a little bit more about compliance requirements. And we've built online educational tools, which means that you can learn a little bit more to make sure that your product has met the requirements. And of course, once a product has achieved the OIDPM certificate, you can then leverage that to go out to market in other countries and other jurisdictions. So just finally to say that our mission is to support the wider adoption of high quality digital health interventions with really the vision of every person in the world being able to access digital health but in a safe, trustworthy way. And so my final slide is get involved. If you want to have a conversation with somebody in the team, you're very, very welcome to. There's a QR code that you can scan, and you'll be shown that a few times over today's webinar. What we find from suppliers is that it really helps them to enhance data policies and instill confidence in their users, knowing that privacy and security are top priority. So thank you so much. I'm very happy to take questions. I think all the questions are going to happen at the end. So as Fee said, if you've got any questions, feel free to put them in the chat, and I'll look forward to taking them later. Thank you.
Thank you so much, Liz. I think we can all agree that regardless of country, we're united by the same concerns, and that the global nature of digital health means that there is a significant value for suppliers in seeking an approach that harmonises assessment standards and allows people to grow incrementally rather than starting from scratch each time. And then this will also allow individual jurisdictions to tailor to their population needs. I love the slide highlighting why are we here, and I think it will most likely be our summary at the end. And obviously, Orca has led the way in developing these methodologies and using technology to facilitate that process for suppliers, but also health systems that will be coming to use those products. So, moving on from a global outlook to the Indian view, I'm delighted to now welcome our next speaker, Rakesh Maheshwari. So, with an extensive tenure spanning over 35 years, Rakesh Maheshwari's career as a government officer within the Ministry of Electronics and Information Technology has provided him with invaluable experience. Retiring as a senior director and group coordinator specialising in cyber law and data governance, Rakesh had the privilege of overseeing pivotal initiatives. His responsibilities entailed leading efforts related to the Information Technology Act, the Personal Data Protection Bill, regulations governing social media, cybersecurity policies, and the ADHA Act. You've been busy, Rakesh. These roles all encompass diverse functions, including serving as Group Coordinator for Cyber Law, Cybersecurity CERT-IN, and the Unique Identification Authority of India. Rakesh, it is a pleasure. I'll now hand over to you to present. Thank you.
Oh, thank you, Fiona, and thank you, Liz, for making such a wonderful presentation, particularly conveying about the need of privacy, security in digital healthcare products, and the trust that the ORCHA mark brings in to the products and to the value system that can be used by anyone, anywhere across the world. So with this background, let me now put up maybe my slides, wherein I shall be talking about primarily as to why we required this particular law. So are my slides visible?
Yes.
Yeah.
So prima facie, I shall be talking about the necessity of the DPDP Act, the Digital Personal Data Protection Act, in the Indian healthcare system, including, of course, the digital healthcare products. I'm talking in for the total ecosystem, the health ecosystem, which not only comprises, of course, it comprises of the hospitals, the clinics, the OPD patients, the inpatients, the public health agencies, insurance agencies, government agencies, pharmacies, research institutions, and of course, the digital healthcare products, particularly the online pharmacies, the growth of which is increasing in the country at a very high, I'll say, CAGR, the online doctor consultations portals, and various fitness devices and sensors. And why this becomes important, I mean, continuing with what Liz mentioned, that the healthcare system, the new technologies and tools that are becoming available, courtesy the penetration, considering the high growth of mobile systems in the country and the increasing penetration of internet, there is definitely much better connectivity and sharing of data. But all this has to be done in a very responsible manner, has to be with the consent of the concerned persons, and therefore it becomes important as to how exactly, this particular law helps and why this particular law was required. As I mentioned, in all these cases, the health personal data is collected digitally or is scanned in digital form and then processed digitally. And when we are talking processing, we are talking for the whole life cycle of the data, is starting from its creation, starting from its collection, to storage, to analysis, to indexing, to restructuring, to retention, retrieval, sharing, and finally destruction. So everything is covered under the data processing, the way this particular word has been used in the Indian jurisdiction as well as elsewhere in the world. Health data, though the DPDP Act does not really differentiate as to what is sensitive or what is just a PII, but all said and done, the bottom line is that the health data is a sensitive data, unauthorized sharing or breach of which can impact the trust at the individual level and can cause, I'll say, difficulties to the organizations or the suppliers of such products. Why? Because privacy has been declared as a fundamental right in India, and it is therefore essential that the privacy, the concept of personal data protection is therefore understood, which is because personal data protection is a facet of the privacy, and not only understood, it is followed. And particularly when we are talking of the digital economy, the Indian digital economy, which is a growing one, so the need was felt to have something which is not only protecting the rights of the individuals, but is also a business friendly kind of a legal enactment which should be there. And that is how, while we have presently the Information Technology Act, which does talk about the privacy and protection of personal data, particularly protection of sensitive personal data. Health, by the way, health records of patients' data has been considered as a sensitive personal data or information as per the IT Act and the rules therein. Because the focus of the IT Act had been many other factors, therefore, the focus in respect of the privacy parameters, particularly, what really happens, whether the consent is really taken, whether the consent is affirmative, whether the consent is free, whether the consent is understood, whether the consent is in the language of the users, which is understood by them. So many of these things were not really there. But as mentioned by Liz, that, for example, while going in for the ORCHA certification, say, for example, ISO 27001 can be proved to be one of such certification models to give assurance at the organization level. So ISO 27001 was, in fact, mandated through the rules to be one such standard which the suppliers or the body corporate, that's how the word has been used, can prove their commitment and their ability to prove this trust, which is very much essential. But as I mentioned, that the IT Act, the IT rules, concerned IT rules were written in a different context. They're already, 13 years old as far as this particular rule is concerned. They were only focusing only on the sensitive personal data, and the scope was also limited to the body corporates. So there was a need felt, particularly after the privacy judgment by the Honorable Supreme Court, that a comprehensive law covering the privacy aspects, particularly in the digital era. And what we have got is the DPDP Act 2023. The Act has been very recently enacted in the month of August 2023, and therefore the Act is yet to become operational. And that's the time when we can actually get ready with whatever services, with whatever products that we are providing in the market as a data fiduciary. So that's the best time while we are waiting for the rules to come up. The standard is, the act is actually reasonably clear in terms of what the expectations from the various stakeholders are. And as has been stated, I mean, of course, suppliers, the one who are actually collecting, one who are actually processing the data with a clear intent, are the data fiduciary within the DPDP Act. The other entity, of course, is a data processor, and the third entity, the most important entity for whose rights that we are talking of, is the data principal. So the Act clearly defines the rights of the data principals, the responsibilities of the data fiduciaries, and the responsibility of the data processors. And it clearly lays down a well-defined data governance structure to be able to handle any issue which may come up. So as far as the rights are concerned, you have the right to access the information which you have provided consent. You have the right for correction and erasure of personal data. You have right of grievance redressal. You have right to nominate. Of course, the law also provides certain responsibilities. As a digital healthcare provider, you are most likely going to be a data fiduciary in the context of the DPDP Act. And that's where there are certain obligations which you have to meet. You have to have a valid consent for the data principal from the data principal. And when we say consent, it has to be affirmative, it has to be lawful, it has to be with proper notice in the language which is understood by the user. It has to be simple, and unless otherwise specifically consented, it is considered to be no. You have to maintain the accuracy of data. You have to have a grievance officer available, and easily locatable on your portal. You should be able to handle any requests relating to personal data, and if required, erase the personal data with the same ease with which it is being collected. The data can be retained, and data should be retained only as long as it is required. And this is where knowledge of other, I'll say, laws, particularly the sectoral laws, the health laws, will become important. The requirement of the data retention. The Act also requires that you prevent, therefore, you take the security measures to prevent the data breach. So whether it is a technical measure, whether it is an organizational measure, all the measures need to be taken to prevent the data breach. And for some reason, if that happens, you have to have the system to get to know about it. You have to have the system to inform the impacted data principals. You have to inform the data protection board. And of course, you have to have an effective grievance redressal mechanism. Any non-compliance, either because of non-reporting or because of clear, I'll say, slackness on your part, not being able to ensure security. And that's how Liz had started. I mean, in fact, Fiona had started with that the kind of incidents which have happened in US, or in fact keep happening almost every day, that they are now onwards, once the law becomes, fully operational, that as data fiduciary, you become accountable and you can be fined for up to 250 crore rupees per instance of non-compliance. So what it really means is that we understand the requirements of the DPDPA, particularly in the context of healthcare. We take all the necessary consents. We must devise a system of how can we really address the requirements of the citizens of the data principles. We must ensure that one, the data breach is not there, and if it is there, it is detected as soon as possible, is reported to all the stakeholders, and the effective corrective actions are taken. And that's where I close my talk today. Thank you very much.
Thank you so much, Rakesh. I was really struck when you said privacy is a fundamental right. And I think that, you know, when we use these technologies, it's really important that as developers, as people kind of marshalling this cause, that we remember that this is fundamental. It's fundamental to the design and development of these products and instilling that trust and confidence. So I feel like the principles of trust is really coming through. So thank you very, very much. And also, I have to say, Liz and Rakesh, thank you very much for keeping to time. You're making my job a lot easier as moderator. Right, so no pressure, Supratim and Jigs. So we're now joined by Supratim, who is a partner in the privacy and data protection and corporate M&A practice groups of Catan & Co. He has advised eminent clients in relation to information technology laws in India, including on data privacy protection, intermediary liability, and cybersecurity related issues. Supratim is considered as a thought leader and has been providing inputs to the government on upcoming digital laws of the country. He has been recognised in the Legal 500 edition for data protection in India for the last 3 consecutive years. Supratim has featured in ALB's Super 50 TMT Lawyers in Asia for 2023 and 2024, and has been recognised by the Economic Times in their prestigious 40 Under 40 list for India's brightest young business leaders in 2023. He has also been recognised by Who's Who Legal Data 2024 as one of the world's leading data privacy and protection practitioners. We are honoured, Supratim. Thank you very much for joining us today. I'll now hand over to you.
Thank you so much. Actually, my work has been made quite easy after Fiona, Liz, and definitely Mr. Maheshwari. I will just add on probably to what has been already told. I'll project my slides and I'll try to again keep to my time. Just let me know once you're able to see the slides.
Yeah, we are
All
able
good.
to see.
Okay, perfect. So I think I'll skip certain things which Mr. Maheshwari has already mentioned, okay, but certain very important things I'd like to pick up from his overarching thoughts and views that he has given and maybe deep dive, okay. So interestingly, many in India and outside India think that, you know, today India does not have any data privacy protection related law. Like Mr. Maheshwari was mentioning, we do have something called the Information Technology Act, and there is a set of rules which is called the Sensitive Personal Data Rules. The name is fairly long. But what is very interesting to know is that when you look at that list of sensitive personal data, there are about 6 important items and there are 2 ancillary. Out of that 6, 4 related to healthcare or health in some manner or the other, clearly indicating that we have been for quite some time now thinking about protecting at least health related information more dearly as compared to personal information. Now, what do you do when you're handling sensitive personal data? You should have proper notice and consent. There's a purpose limitation, collection limitation, retention limitation, transfer and sharing restriction, data security requirements. So what you see in our new DPDP Act, in some form, it's already there in the context of sensitive personal data, which is anyways critical to the healthcare sector. Now, interestingly, if you look at this provision section 43A, it states that it's basically giving a remedy that damages by way of compensation will be payable to the affected person in case there is a breach or there is an impact on the sensitive personal data. when GDPR came into effect, some of the people in India sat up and said, oh my God, 20 million euro or 4% of annual global turnover, we must do something about it. Interestingly, in the Indian law for a significant amount of time, we have been having this provision which has got an uncapped bucket. The forum changes from one to the other, but technically speaking, an uncapped bucket where, penalties could be levied or damages could be payable of by way of compensation. There is also another provision which is in relation to only personal data where imprisonment could have happened. Very recently, that has been amended and has been made decriminalized. So now we're looking forward to the Digital Personal Data Protection Act. And again, it has got, like Mr. Maheshwari was mentioning, it has got a profound impact on the healthcare sector. It covers digital personal data only. So, the scanned medical prescriptions or telemedicine, everything, largely would get covered under this particular set of this law. Um, Also, we talked about significant data fiduciaries. Now, what is this? There are two kinds of data controllers. Data controllers are basically, in essence, known as data fiduciaries in this law. And there are two categorizations. One is the normal data controller or data fiduciary, and one is a significant data fiduciary. We'll talk about this in a subsequent slide as to how additional things need to be done. And probably at least some segment of the healthcare could come under the purview of or be categorized as significant data fiduciaries. There has to be a very, very robust grievance redressal mechanism. And you have to listen to the data principals or individuals whose data you are handling. You need to ensure that, you actually lend a ear to their requests and grievances. The government is increasingly becoming sensitive towards this aspect. Also, there is no categorization between normal personal data and sensitive personal data. So maybe when you're setting off to sail, it's great. It would seem like it's great because I need not sit down and decipher and distinguish between normal personal data and sensitive personal data. But interestingly, when you read some other provisions of this law, a simple one could be when you get categorized as significant data fiduciaries, when you are handling certain kind of information, which is more sensitive in nature, you could get categorized as significant data fiduciary, and therefore there'll be more responsibility and liability which will come on you. Also, if you look at the penalty related provision, so Maheshwari was talking about it, and I'll also show you the slide on the entire penalty schedule. You'll realize that how can you trigger probably the highest quantum in a particular kitty? One of the parameter given is the kind of data that was breached. So when we are setting off to sail, very interestingly, we are told that don't bother. All data needs to be protected equally. But in a bad day, you might get slapped harder because you had been party to a breach. Because you did not protect the, say, a health related data more dearly. Transfer of personal data to other jurisdictions. Very important when we are doing cross-border healthcare related transactions right now. Maybe the aspirations of the acquirer is that, the health data needs to be taken outside for whatever reason, it could be for studies, etc. What is it that this law is talking about generally, on a sector neutral basis? It says that free transferability of personal data is allowed across jurisdiction, but two things need to be kept in mind. One is that if there is a stricter law, then that will still prevail over this general leeway. And the government has the right to come up with a negative list of jurisdictions. Transacting in data qua those jurisdictions could be embargoed or there could be certain restrictions. Handling of children's personal data. Firstly, you know that in India, the age of consent is fairly high. It's 18 years. Under GDPR, it is 16 years. It can go below up to 13 years, depending on the member state. So there is bar on targeted advertisement and tracking and monitoring of children. So when you have these healthcare apps, etc., also you have to keep this in mind that these are still applicable in the context of a child. Data breach reporting. I think this is a issue that you need to be bothered about even today, because the cybersecurity related organ or body, which is a certain Computer Emergency Response Team of India, you are supposed to report data breaches or cybersecurity incidents within 6 hours of either noticing it or being brought to notice about it. Till date, certain used to largely ask technical questions. Interestingly, now they are sending additional questions, which are stating that was there any personal information involved? Was there any PHI involved in that data breach? Now you can clearly see how the mindset is changing. CERT is actually going and checking the dark web whether any Indian company's data is up for sale. They're sending those screenshots to the relevant organizations. They're also sending show cause notices to organizations that you have breached the 6-hour reporting deadline. So you can imagine it's much more proactive as compared to what was there a few years back. Also, there is the next point is that there is no specific obligation on data processor. So, Mr. Maheshwari, you're saying that, listen, in all probability, an organization will be a data controller or data fiduciary, and you would give a lot of data, say, to your data processor. Simply, taking an example could be your payroll processor. You are saying that, listen, first of every month, my 1,000 employees should be getting these respective salaries. As per this law, there is no obligation on that processor. So you need to contractually ensure that you pass on the responsibilities, liabilities to that particular data processor. And in India, it's a little more trickier than it sounds, because you can't just write a line that you will indemnify me for everything. You can, the regulator will ask you to pay that 250 crore rupees, and you will take a lifetime to procure 1 rupee from your processor under indemnity. So you have to be smart about it. What all should we be adding? Do we think about things like a bank guarantee, or check the insurance coverage of that particular processor? Do we need to keep some holdback, etc., etc.? So you have to be very creative and think through the arrangement between a data controller and data processor as far as the agreement is concerned. The last one is in relation to the consent manager, which is a very novel concept. Time is less, so I'll explain to you in a very brief manner. When we were discussing about consent as a ground for processing, we realized that in a country like India, consent is virtually useless, okay? Because you have a large illiterate population, people are speaking varied languages, etc. So what do you do? Even the most educated people are not reading what they're agreeing. They're simply pressing I agree and I accept and moving ahead. So then the thought process was that, can we have a service provider of sorts? I'm very crudely speaking about it, where to whom you give a power of attorney that, listen, I'm okay to give my consent for ABC, but I'm not okay to give my consent for XYZ. And that particular consent manager, actually takes care of your request. So you have to ensure that you have to deal with this. Significant data fiduciaries are those who could be categorized. They are yet to be specifically called out, but if they are processing large volumes of personal data, sensitive personal data, or there is risk posed to rights of data principles, then you get categorized. You'll have to do impact assessment. You'll have to do periodic assessments, audits, and DPO office has to be created. A data protection officer has to be there in India. I think this has already been talked about, and I will just sort of glimpse through. Consent has to be very, very different as compared to what we have seen till now. Data subjects, whether it is your employee and your customer, they can come knocking at your door and say, listen, I want to access my data. I want to exercise my right of correction and erasure, right to nominate, I want to exercise right to grievance redressal. All of that could come into play, and you have to be prepared and accede to it. So I think, just to keep it snappy, I'm almost at the helm of my time. Mr. Maheshwari has already shown this. I've just added the GBP amount so that it is easier for the international audience also. If you look at it, the good part is there is no criminal sanction. There's no imprisonment provision, but the monetary penalty can be fairly steep. It can be GBP 24.12 million or more, depending on what has happened. And therefore, this has become a board level discussion. And people are actually trying to move towards a zone where they are ready to be compliant with this particular law as soon as this comes into play. Thank you so much. I will pass on the mic back.
Thank you so much, Suprasad. That was very, very rich with information. And wow, I looked at a report recently that said that something like 80% of life science companies in the UK are SMEs. And so those fines for an SME are terrifying, and it shows the importance of making sure that you're compliant and understand legislation and the intent behind how it's due to be applied. And I think it's really interesting to see that, you know, for those of us with the GDPR hat on, it's really interesting to see that there isn't that differentiation between personal and sensitive data. And that some of your comments around the jurisdiction requests and the data breach reporting, and the role of the fiduciary. So thank you so much. That was really, really interesting. And I think really, really built on Rakesh's presentation just prior. So just a reminder to everybody that has joined us today, please, please, please do ask questions or make comments or be ready to engage in a discussion shortly. I'm now going to hand over to our final speaker, who is Jigs Parasara. Jigs is a first-generation entrepreneur who combines strategic and tactical business planning with the ability to analyze complex situations, design practical approaches while implementing cost-effective solutions. Jigs has worked and learned through his experiences in the world's leading banks, including Bank of America, HDFC, and Deutsche Bank. A passionate advocate for societal well-being through his work with Alpha MD and its not-for-profit HWD India, we are delighted that today Jigs will be telling us a bit more about how to get involved and maybe shed a bit of light as well on sort of the opportunities for digital health suppliers in India. So Jigs, over to you.
So thank you so much, Fee. Thank you, Mr. Maheshwari, Supratim, Liz. Most of the things which I wanted to speak, you all have covered. So I'm very pleased that, we are talking seriously about digital health, safe digital health for the patients. So when I met Liz first, while we were, creating this partnership and we developed OIDPM, one thing which really hit me was that if drugs have to go through regulatory approval for safety of the patient, then why not digital health when patients are involved there? And that is something which really I took back from Liz's office, came back to India, and I realized that something for the compliance of patient data and something for the patient when they are using digital health needs to be brought into India. Something where, with the DPDP Act, the seriousness of the government, if we want to enhance that seriousness, if we want the SMEs, like we clearly mentioned that SMEs are important, with SMEs having these kind of, they don't have this kind of money because I am also an SME, so I know that if 250 crores is levied on them, then they are going to get bankrupt. So how can we help, and how with the Orca's experience, global experience, we can get OIDPM to India? We can help the companies to be compliant, be safe, create these products which can help patients. And like patients having medicines, why not digital health apps where patients can then, or consumers can actually subscribe to these apps, and they can use it safely without getting worried about their data getting compromised. So that was the whole reason why we are here. Most of the things are covered. We would love to open questions for people to ask, because this is a very important team which is sitting here, because with the global experience, with Supratim being a leader on the legal side, Mr. Maheshwari from the government side, it is great if you can ask questions, clear your doubts, because this is a time which you can utilize and get prepared for the DPDP Act. Thank you so much.
Thank you, Jigs. So yes, it is now time to open up to our audience. And I can already see that there are a couple of questions, one of which someone has responded to, but we'll bring it to the floor anyway. The first question is, there is a misunderstanding in lots of technology companies that having user ID and password OTP provision makes their system data protected. Please elaborate on DPDP is something more than that and not just having basic data privacy security measures. Who would like to take that question? Supratim?
Yeah, so happy to take it. If I've got this correctly, of course, the understanding of what this particular law tries to achieve, I think, is quite misunderstood. Let me give you a simple example. When GDPR was coming into effect, a gentleman came to my office the night before. and say that, listen, my boss has sent to me, I need to be GDPR compliant. Here is a copy of my privacy policy and terms of use of the website. Just please make minimal changes. I want to upload this tonight so that tomorrow morning onwards, we are GDPR compliant. So that's the common man's understanding. And I would not even say common man, actually. It's a highly placed official in the legal space in India who had that kind of an understanding regarding GDPR. So it's a quantum leap for India, right? So we have to understand this. It's a 360-degree sort of view on data privacy and protection. So therefore, one needs to understand that uh, there are elements in relation to what rights individual has, what questions they can ask to you, and the other aspect is protecting that particular data as well, right? So I think that will be the very high level thought process on a DPDP Act.
Thank you, Supratim. And
Yeah.
it just makes me think that for a
I think
developer. Sorry, go
apologies.
on,
I think
Mr.
Rakesh, you
Mayor.
wanted to add something. Yeah.
Yeah.
I'd just like to mention, I mean, particularly the question that has been posed. See, as long as data is not breached, we are okay. But please be aware, it's not you alone in the whole ecosystem. There are employees, disgruntled employees, threats from within and threats from outside the organization. So if you think maybe having just a user ID and password or maybe certain OTPs will make you safe, it's your choice. But in my view, you are wrongly, highly misplaced. Maybe taking it too simple, it doesn't work. That's it. That's it.
You've all been told. Yeah, so I think for a digital supplier, for an innovator who is looking to develop a product, what advice would you give to them to then think about how they develop with the DPDP Act in mind?
Yeah, maybe from my side, of course, to be added by Supratim or any one of you. See, please be aware, whatever product, whatever application that you are going to develop, as to what kind of data, personal data, that you are going to collect, that you are going to process, maybe you are going to get from outside, and whether the one which is being given to you is also authorized one or not, is a lawful or not, what kind of laws are there, sectoral requirements are there. Particularly, I mean, I always focus on the retention part because the rest of the things are already taken care of either in the DPDP Act itself or maybe in other parts of the IT Act. Particularly, Supratim did mention about the cybersecurity directions which CERTIN has issued. So all of them have to be applied. The bottom line is be aware, take consent of whatever is being collected, and ensure that the data is safe, secure while it is being processed by you. Of course, as a startup, you have certain exemptions, particularly in terms of, say, erasure, in terms of maybe putting the consent notice, in terms of maybe probably addressing to the grievances. So certain exemptions are there, but at the end of the day, security of the data being collected and being processed by you is the bottom line. No breach should happen internally or externally.
So, Pratin, did you have anything
right.
you wanted to add?
So just wanted to add, see, by now what we have realized is the global gold standard has been set. And I think Jigs was mentioning this, that it is wise to imbibe this because many or most of our products and services these days are operating cross border, right? So of course you have to be compliant with the applicable law, but it is also perhaps a very smart thing to do that you have a defensible strategy. Even after you have done everything, there is a possibility that something could go wrong. But that day, if you're able to demonstrate compliance, what did you do? Did you sit tight and do nothing? Versus I tried to do everything, but then something went wrong. The regulator would look at it very differently. And if you look at the penalty related provision, the way it is crafted, it's also alluding to a similar outlook from a lawmaker's perspective, that we will consider certain parameters when we are, slapping the penalty and looking at the highest number, repetitiveness of the breach, what did you do to mitigate, etc., etc. So I think a wise thing to do is that there is by now quite a bit of global gold standard which has been set. Okay. And therefore, we can always follow that and maybe just check for the delta in particular jurisdictions, whether it is India or other jurisdictions, and plug that piece.
Mm. Yeah, absolutely. There's that difference, isn't there, between being really proactive and just allowing things to happen around you. Liz, you said yourself at the beginning that you've been working with sort of, you've done 27,000 digital health assessments. I just wondered if you had any advice as well, to sort of digital health innovators looking to ensure they have compliance against the DPDP.
Yeah, I mean, I think my biggest piece of advice is start as early as possible. Don't wait. And that doesn't mean to say that you even have to wait till your product is launched, because quite a few of these requirements are at point of design. So get in early, understand it, and be ahead of the crowd.
Amazing. And I know that we've spent quite a bit of time talking, haven't we, about security by design and thinking about how do you get that right from the very beginning rather than having to retrospectively fit. And we know that for those products that have shifted their business strategy as they get bigger, to retrospectively do that is pretty expensive. Jigs, do you have any advice or words of wisdom?
No, nothing. I'm seeing more questions coming, so I would rather take those questions.
Fantastic. Okay. So the next question has been answered, but I'm going to read it for the benefit of the audience. Is there any tentative timeline by when can India expect the operational rules under the DPDP Act? Also, should there be sectoral laws specifically for healthcare sector when it comes to data privacy? In 2018, there was the Digital Information Security and Healthcare Act was drafted, but was never discussed further. Rakesh, you said it is expected the draft rule should get published in June 2024 and the law should become operational by early next year. The sectoral laws are already there or need to be there because in such sectors like health, it is important that the data retention requirements are understood, and also the sectoral regulators can impose any specific requirements that are specific to that sector. Is there anything else you wanted to add? No?
No.
Okay. Does anybody have
I have already
any?
conveyed.
Oh, go on, sorry.
Yeah, I have already conveyed at least my part of what I thought maybe the response.
Yeah,
Which
no,
you
I
read
think
out.
absolutely agree. I think it's about time that we also start looking at a specific legislation as well, which fits into, of course, the overarching superstructure of the DPDP Act. There is quite a bit of political will, at least before the election got announced, which we saw that, the government wants to probably go full steam in relation to the Digital Personal Data Protection Act. And let's see, I think right after the elections, which should be June first week, after the announcement of the results, we could see a lot of action.
Thank you. So I'm just popping from the Q&A bit to the chat bit, and I can see, how does the DPDP Act impact cloud-based medical research data storage? The data is anonymized.
Yeah, so I think this is a very good question. See, today, when you look at the Information Technology Act and other laws that are there, rules, etc., there is no specific standard in relation to anonymization. Okay, there could be a thought process in future by the government that there would be a particular standard which is called out by the government, and it will be a rolling standard. It cannot be one static standard, because today, and we were discussing this with Justice Sri Krishna when he was crafting the law, and he said that today what you think is a good standard for anonymization tomorrow may not work, and you could identify the person. Uh, Now, if you look at that, therefore that as a construct, today there is nothing specifically called out, but when you read the law is talking about personal information and sensitive personal information, which has to be personal information first. So in essence, if it is fully anonymized and absolutely irreversibly extricated from the natural person's identity, and you will never be able to understand who the natural person is, then the provisions of the Information Technology Act and the rules, what we talked about, does not apply. This is also the truth for many other global laws across the world. Um, Under the DPDP Act, if you look at it again, it has restricted itself to personal data, digital personal data, and it has not talked about anonymization. So till there is further guidance, which comes about, you could consider that if it is fully anonymized, then there would be an insulation. Also, remember that for research, there is an avenue which has been created, which talks about a lot of the provisions of the law would not apply. In case it is for research purposes, there could be certain guardrails which would be provided, of course. So that's again another exception.
Thank you so much. Really, really interesting. And I can see that Felix has asked, do we need a specific act for health data governance, including protection and privacy, given the high sensitivity nature of health data?
Right. So, like I think Rakesh has already responded to this. I just added. So what we envisaged is this DPDP Act will be a mother umbrella legislation, and under that, sectoral regulations and regulators will have to play their role. So that is what should happen. Of course, healthcare is a very sensitive. There was an attempt, which was just mentioned in the Q&A, the first one that you read out. There was an attempt made, but that did not go through. So hopefully this will be a starter. The DPDP Act will be a starter, which anyways, again, putting India into I would say, a gold standard zone. And from there onwards, sectoral regulators will pick up. Already, some of the regulators have started picking up. The Reserve Bank of India, which is the financial regulator, have started sending notices and questions to some of the players that they regulate, stating that, what are you doing to be compliant with the DPDP Act? What do you think could be your challenges? What are you thinking about? How will you overcome those challenges? So question and answer, both you have to give, basically.
Jigs, you're laughing.
Yeah, because the question and answer both you have to give.
I think it sounds like watch this space then for further developments in this field. So if there aren't any more questions, I think what we'll do is we'll look to wrap up the session. First and foremost, thank you so much to our panel of speakers. Your insights and input was incredibly valuable. So thank you very, very much. Today we have heard about Orca and its work in digital health assessments, and how in its work to develop assurance frameworks, but also its work to activate these products, it's really positioned itself as an ally to support digital health suppliers to comply with these really key components in developing a really best-in-class product. And obviously, we've also heard in the last sort of 10-15 minutes about the importance of future-proofing and really thinking about these things right at the very beginning of product development. And so I'm sure that there'll be some thinking for digital health innovation hubs and incubators, not just in India, but also more globally as we look to potentially, as India hots up as a market for innovators to export to. Rakesh, you obviously shared the strategic direction of India and the building out on previous acts, and so presumably you shared your technical knowledge on the DPDP as well. And once again, thank you so much for the invaluable insights. To hear your expertise, it really came shining through. So thank you. And I also want to say a sincere thank you to all of the attendees for participating in today's webinar. For those of you who asked questions and being a receptive audience, we would love for you to continue the conversation on socials using hashtag #OIDPM. So please do, if you've got comments or you've got thoughts, please do comment and linked on LinkedIn and so on. We also encourage you to go on to visit our website. My hope is that Liz will shortly be sharing the QR code, which will take you through to our landing page, and that in turn will allow you to download the product data sheet, which is a high-level view of the OIDPM assessment. But I think what's becoming abundantly clear, what was highlighted in the examples at the beginning of the session, but also what has been strengthened throughout the session, is that despite this legislation, its application and how digital health technologies kind of apply the rule of the legislation is not always straightforward, and we do still see instances of products that are receiving significant fines because of breaches. And as we said at the very, very beginning, this is really fundamental because it erodes trust and confidence in these apps, which ultimately deters their usage, and which means that we, as the public, can't yield the full benefits of digital health. So I think we who are speaking today are passionate advocates for digital health. We're a captive audience, and we truly believe in its power to revolutionize healthcare. So we're so incredibly fortunate to live in a time that has these immense opportunities, but trust and confidence are vital. So again, thank you very much for joining us today. And I think with that, we can now close the webinar, but there will be future webinars that will start to look into more detailed topics, including comparisons, more specific comparisons with other legislative frameworks from around the world. So once again, thank you very much.
Thank you.
Thank you.
Oh, thank you.
Yeah,
Thank you
thank you very much.
Yeah. Okay.